Thank you for your kind introduction, and I'm very glad to witness the past 10 years achievements of Director I's team. Director I and President Zhang, they have a lot of experience. I would like to share with you some of my personal experience in using focused ultrasonic ablation surgery technique. So previously it's a low energy ultrasound. Ultrasound is more often used for diagnosis, and it's also very safe for human, like the 4-dimension ultrasound and check for feeders and all these are common applications. But now we started to use a transducer. Then it can generate an enhanced ultrasound in the focal area. It has 3 effects: mechanical effect, thermal effect, and the cavitation effect. So it can generate over 65 degrees of degree, and then it leads to the coagulative necrosis so that's, and also the cavitation effect. So those are the mechanism why it can be compared with the surgery, because first of all, a very precise ablations can be achieved in the ablated areas and non-ablated areas, and it has a clear margin. It's just like using a scalpel to cut away those sick tissues. So it's about a margin of 50 micron, and then the core components, and those are the ultrasonic imaging devices, and then for those dots, lines, or volumes, we can compare with other ablation methods. So high intensity, and we'll be able to achieve 3-dimensional treatment. Well, yesterday, as we know, there is a military parade that shows the development of China. So regardless of the military forces or technologies, we've seen some breakthroughs, and then doctors in those high flow areas, according to the location, sizes, and shapes of tumors, we can develop a personalized solution. And then there are other physical ablation methods such as microwave, cryo-lasers, etc. So insert the needles into the center of the tumor and then generate energies in that area. However, the energy, as we know, normally is the ellipsoidal shape with 3 centimeters. However, tumors and shape may not be irregular, so that may have residues in those irregular shapes, and also closer to the tip of needles, and energy is higher than getting far away, and it's lower. However, such approach may lead to pool necrosis in the outer side of the range. So here is a 3D demo. Now this is an ultrasound guided approach. What's the differences between ultrasound and an MRI guided? We have also seen previous sharing. In this process, we can see the fibroid and tissues. So normally, majority are low echo in image. So with accumulation of energies, and there would be a coagulative necrosis, and you'll be able to see a change of mass gray scale. And then using temperature measurement to understand more. MRI imaging is slow, and so one frame of images will be generated in 20 to 30 seconds. Therefore, the efficiency of treatment is low. For T2 low signal fibroid with 5 centimeters with an ultrasound guided, it takes about 42 minutes to 1 hour to complete, while for MRI guided, it takes about 3 to 4 hours. Therefore, especially in China with a huge population number, it's difficult to have an MRI, majority of them done by MRI guided. And then the application of OB diseases includes fibroid and adenomyosis, placenta, and acreta, etc. Actually, since 2000, we started to work on the first uterine fibroids. In 2005, we have started to do more cases, and so it's been over 20 years with accumulation of experience and also optimize the protocols. So it has high intensity focused ultrasound has been included into the experts' consensus to treat the uterus of a fibroid. For the chapter of uterus fibroid, it's already included in the guideline. Meanwhile, there are some international guidelines that includes USgFUS into clinical guideline. We also did some trial. We enrolled 757 patients with uterine fibroids. So there were different types of uteroviral fibroids, submucosal, intramural, and subserosal. The treatment results were satisfying. All we focus is the reduction of fibroid after HIFU treatment and improvement of symptoms. After follow-up, we see that at month 6 post-surgery, the shrinkage is about 58.5%, and then we had a master review afterwards. 80% of the patients and around month 6 volumes can be shrinked more than 50%. Meanwhile, you can also see symptoms improve after HIFU treatment. Well, because many patients have symptoms with administration. Then after 3 months, we can tell that it has reduced to 20 symptoms severity scores. U.S. had an epidemiology survey on the normal females locally. So their score is around 20. Therefore, after HIFU treatment, 3 months after treatment, so their period situations has recovered to normal level, and then they can be maintained more than 36 months.
Okay, we can also see that about the population rate of the myoma volume. In our assessment system, there are two researches that for the uterine myoma, if the ablated volume is over 60%, then in the next 2 years, when the probability of the recurrence is 11%, and otherwise that is higher than 10%. Why? Because for the recurrent uterine myoma, we just use the laparoscopic surgery. Some of the small myomas could not be just completely removed. So the residual myoma could be the cause of the recurrence. And more than 10 years ago, we just finished the reproductive research program during 5-year plan. We just worked with more than 10 other countries for 5 years, and the research result is like we just compared the hysterectomy and laparoscopic surgery, and in 2017 the research has been published on the BGOG, which is the British Journal on Gynecology, and about the efficacy, the assessment, and also the quality of life of the patient, we can see that if we just reserve the uterus, the FUS has just greatly just improved the quality of life, and after the 1 year and 1.5 year after the operation, we can see the FUS could just lead to the best quality of life. And also in 2020, the Wang Wei just team just started to just publish the paper. Their team is one of the team, just one of the earliest teams focusing on the FUS, and also for all of the subject has experienced the surgery of the uterine myoma. They have divided them into two groups. So one group that used the FUS, so another group that used the surgery modality. We can see that during the follow-up, we can see the dark blue means the FUS groups, and that we can see the 3-year the reoccurrence and reintervention rate is much lower. So we can see that for the FUS, we can see there are many other subtypes of the uterine myoma. According to the clinical indication, it is the indications are the symptomatic the uterine myoma, or some of the patients without the symptoms but has the psychological burdens. And for this kind of patient, and they are also the indications for the FUS. So for the type 1 and type 8 of the uterine myoma, so they can just undergo the FUS, but the best indications are just belongs to the type 1 to type 6, and we suggested that for the cervical the myomas, some kind of the cervical myomas could also be cured by the FUS. The FUS just for the myomas with the size higher than 1 centimeter, the ultrasound image could just clearly show it, and also it has the safe ultrasonic and acoustic channels. The acoustic channels shouldn't have the intestinal tract, and also because the energy converter has the fixed size, so the focal point must be able to reach the target lesion. And here, of course, there are some contraindications. The contraindications include some disease on important organs, and also if we find there could be some other kind of malignant lesions of the uterus, then it belongs to the contraindications. And also the contraindications includes the absolute contraindication and comparative contraindications. For example, for some comparative for some of the patients, if they just use the medication, they can also use the HIFU, and for some of the myomas with the reach the blood supply, so we can use the other concomitant treatment, combining HIFU and other intracranial treatment. And this the weekend we also just attended another training program, and they're just using the HIFU and also intracranial treatment for the uterine myomas. And just now I've just mentioned that the MR signal. First of all, through CDFI, we can just have the initial judgment. We know that the blood supply can be just divided into 4 levels, and for the level 1 or level 2, it is easy. For level 3 and level 4, it is difficult. So for level 3 or level 4, we can just do some other approaches to improve the blood supply. And for tier 2, the signal, and there are more the fibrotic the tissues. It is it could just easily accumulate the thermal the heat. So as the for the and also for the intensified the phases, the different levels of the infusions could also just impact the outcomes. And also the position. The position is very important, and we need to just we must let the patient to lie on the bed, and also we can observe the position of the myoma, the size of the myoma, and also pay attention to the acoustic channels, and also the transformability of the bladder. If it is the bladder has a good has been easily reshaped, and it could just extrude the intestines out of the acoustic channel. This will reduce the difficulty of the FUAS, and if the bladder has is less reshaped, cannot be easily reshaped, the patient must just exercise the bladder and improve the elasticity of the bladder. And also we need to understand is the relation between the myoma and it's the bones. So and we need to just see that during the real operation we can just observe the relations between the myomas and the bones. And also here we can see that about the timing of the HIFU and the preparation for HIFU on the skins and the intestinal tract. This will just help us to improve the success rate of the HIFU. So many details of the HIFU could determine the success or failure of the HIFU. And also before the HIFU we need to prepare the food and remove the stools into the bowels. So this will also improve the outcome of the HIFU. So and also before the HIFU we need to just pass the water and remove the urines, and the urine could be the best media of the heat the transmission. So the urine removal is the most important. That's very important. One of the patients is in South Korea, and they just did the urine, the urethral catheterization, but they carelessly just induced some bubbles. This is very dangerous. So we just repeatedly infused the bladder, and we could hardly just remove the bubble, and this just made us fail to just carry out the operation on the first day. And also the water sac is very important. The water sac is very important, and it will just help us to just to extrude as the bowels and intestines, but we need to pay attention that it will not just lay more pressure to the skin. And here this is the 4 phases of the image, and we will just choose the region of interest. The region of interest will deliver the best effect, best the efficient, and will just deliver and will also just deliver the melting of the blood mass. So we can see that the higher proportion of this kind of the process will improve the efficiency of the operation. Also, the post-operation steps are also important. First of all, we need to just empty the bladder and rinse the bladder with the cold saline water, and so as to cool off the operation areas. So we need to just keep the saline water in the bladder for the more time after the operation, so as to remove the heat inside inside of the uterine, so as to just prevent the heat damage, the thermal damage, or the nervous stimulation. And about the MR is a very good approach for the post-operation research. If we find that there's any residual myoma discovered through the MR, we can just do the follow-up the operation, and also we can see the safety of the MR. We can see here this is a very beautiful non-infusion areas. It is a black hole, and also for the size and the numbers of the myomas. Just Mr. Zhang talked about the MR-induced ultrasonic operation. It is quite different from the ultrasound, the ablation, and this is the removal for the 50-minute uterine myoma. We just use the HIFU to do the conformal treatment, and you can see it is very good. And also we have also encountered the cases of multiple uterine myomas with the demand for the pregnancy in the future. So we can see that if we can find the lesion accurately and do the treatment accurately, then the serosa, the endometriums, and can be just preserved very well. So about the follow-up, post-operation follow-up, we can do the clinical and imaging follow-up, and 3 months, 6 months, the 12 months, and 24 months after operation, we can just observe the size of the myomas. One case is that the myomas can of the size at the size of the 5 centimeters. After 1 year of the operation, it can be just it can disappear, and for in some cases the myomas could just shrink and just become necrotic. And about the post-HIFU gestation, we just carried out some research to do the detection, and our consensus is that according through the systematic assessment after the HIFU, we can see the gestational the time is sooner than the invasive research. So 3 to 6 months after the HIFU research, the patients can get the gestation. And also we can see that according to this research, after the HIFU, the gestation rate and is higher and sooner.
So whether baby can be delivered via vagina after HIFU. So we had a follow-up for those patients treated with HIFU from 2008 to 2014. We saw that with a retrospective analysis, and it is feasible and safe to have a vaginal delivery after HIFU. So this is the first case, 29 years, and female multiple uterine fibroids, and you can see tumor has compressed and endotheliums. It will have impact on the pregnancy, and we had treatment and in advance, and finally she had a C-section. And this is a case too from Liaoning province, and whose experience is more complex, and so there's a fibrosis found due to fetal arrest, and also second pregnancy occurred 4 months after ablation, and then delivery. So though being treated with HIFU, well, since there's a necrosis, and therefore there is no significant change in the size of the fibroid during pregnancy, and she has delivered twins. This is a 30 years patient with a menorrhagia and anemia. You can see in order to further improve the situation, you can see HIFU Center, doctors from HIFU Center. There has been a removal of the necrosis and tissues and under the hysteroscopy. And there's also a delivery of a baby through vaginal. Currently, there's over 3,000 of HIFU cases, and later, Dr. Hawa will also share with us about how ultrasound treatment can be combined with assist ART. Now, its advantage of HIFU is a non-invasive treatment. It protects our uterus and the fertility of female, and also the recovery time is quite short.